Welcome, please, Daniel Kraft.
All right, thanks. Great. Thanks a lot, Mike. Thanks a lot, Rob, and it's great to be back here at WLSA. And I have the tough act to follow piece at the end of the day after a lot of amazing content and ideas were shared, but want to sort of cross a big swath of healthcare and look at where this convergence can take us in digital medicine and beyond, whether it's our own personal health and prevention, how we can optimize our health, how we can change how we do diagnostics, therapeutics, discovery, and even apply some of these technologies across the planet in global health. So I think one of the things we're all seeing here is that healthcare has traditionally been pretty siloed. We define things in old academic buckets and specialties and old ways of thinking. And our healthcare system is much more of actually a sick care system built on intermittent and reactive models. We get intermittent data traditionally, a blood pressure, an EKG check, a lab piece of information that you have to fax to your physician. And we're very reactive in our traditional models. We wait for the heart attack, the stroke, the lump to be discovered at stage 3. And our data still is actually pretty scattered in silos. Most of our EMRs don't talk to each other. There's this new issue that's being in the press about data blocking and not being shared amongst different parties. And so the feedback loops that we really need as individuals, as consumers, as patients are often broken. And I think the hope of our new connected age is that those feedback loops become open and we can apply all the rich analytics, AI, and beyond to make sense of them. And to expand access to care, because in most parts of the US, let alone the rest of the world, we have a shortage of primary care physicians and specialists, let alone in different parts of the planet. I was just actually at NASA doing a workshop. They're trying to think about how to bring healthcare to Mars and other places. And educating ourselves, whether we're in pharma, biotech, devices, as physicians, is still slow. It still takes us 17 years from discovery to application. And as Eric Topol mentioned well this morning, it's still, the average 37 to an hour visit, a wait in the waiting room before you see your clinician, and often days to weeks for those appointments to occur. But what I think is most exciting as we shift in this new era is that the incentives are changing. Instead of being in the sick care side of the equation, where 80% of our healthcare dollar is spent on the 20% who already have disease, we're starting to shift a bit of our focus to wellness and prevention and keeping folks from getting there in the first place. So instead of our sort of reimbursement-based model, we can shift to one that's much more truly evidence-based. And this new connected era of technology is shifting where healthcare happens, from the traditional ER and hospital and ICU to never coming to the hospital in the first place, coming into our homes, onto our bodies, and beyond. So a really interesting time as we shift the incentives and the technology is aligning to meet some of these big challenges. Now, of course, a lot of this technology has been driven by, as was mentioned earlier, Moore's Law, a 50-year-old publication by Gordon Moore from Intel about computation getting faster and cheaper and better. And it's an example of an exponential technology, meaning it's doubling in its speed and price and performance about every 2 years. And our brains, though, have trouble thinking exponentially. We're linear thinkers. 30 linear steps, I'll be to the door. 30 exponential steps, I'll be at 1 billion steps. That's 24 times around the planet, to the moon and back. And it's the power of those exponentials that are coming to play that's really shifting the world around us. So the iMac of 2000 now fits on your iPhone, and now as of 2 weeks ago fits on my iWatch. And now computers are shrinking to the size of a grain of rice and are going to be disappearing increasingly into our bodies and everywhere else. So the challenge for all of us is to think exponentially, realize how much the world's even changed in the last decade. I mean, these computers in our pockets and our tablets, computers which are faster and better than a Cray supercomputer in the 1970s, are becoming ubiquitous. I was in India a couple months ago. They're now being sold for $35 for these tablets. We can almost give those away to patients around the world. And so really interesting opportunities there. But because of the way exponentials work, sometimes we're in this era of a lack of imagination. And I think I want to challenge you all to think exponentially as we move forward, not just in Moore's Law, but in a lot of fields that are coming together, whether it's 3D printing, robotics, artificial intelligence, big data, social networks, and beyond. And that's that convergence point where things mash up, when we can really do reimagination and reinvention of healthcare. And we need to think differently and convergently if we're going to address all these grand challenges we have, which I won't take the time to go into, but just recognizing the fact that a lot of the solutions, many of the amazing entrepreneurs and others on the stage have already brought some of those solutions to bear, but our friends at the FDA, the F word, and our friends, the payers, often don't know how to play with these. They're sometimes behind the exponential curve. So we have the challenge to get these things adopted and valued. So clearly we're in this era now of digital health, connected health, mobile health. I think it's not going to be called digital connected, it's just going to be called health. The digitization is, of course, becoming ubiquitous and provides really interesting disruptions. You know, you don't buy a GPS unit anymore, or even a flashlight. You download them as an app. And that's changing entire fields. What used to be $1 million almost of technology you can carry around in your pocket. And that clearly has implications in healthcare and has disrupted many other fields, from how we pay for things, how we read. Amazon self-disrupted with ebooks. Companies like Blockbuster have gone bust. Uber's been mentioned here, you know, the Uber of healthcare. But what's interesting about Uber, they're only a 4 or 5-year-old company, didn't invent GPS, online maps, online payments, taxis and limos. They connected the dots. They layered existing convergent technologies to the point where they're very disruptive, and we're seeing the pushback. I was in Europe. It's been outlawed in Berlin. There's strikes against Uber. When you see sort of these new technologies come in, as is happening in healthcare, there's often fights in that space. So we can take lessons not just from the reinvention of travel, but some of the other sensibilities, like bringing, you know, a physician to your house or apartment within 3 hours. You know, the joke is, you know, you're not sure what kind of doctor you get, but you'll get a doctor and you get to rate them and they get to rate you. So that transparency element is there. And of course, the digital natives now all expect this sort of utility, including in their healthcare. Uber even did their own little health pilot. You may not know this, last fall, where you'd press a button on your Uber app if you're in New York, and a nurse would come and give you your flu vaccine. So this is coming fast and furious. And if you're not thinking exponentially, you can have your Kodak moment. Kodak actually invented digital photography. They actually had all the patents, but they didn't want to cut into their film sales. So what happened? They kind of went bankrupt a couple years ago, and 12 kids down the street from me in Palo Alto sold Instagram for $1 billion, which is like chump change now in healthcare IT, at least in IT. So the challenge is to think exponentially and shift the world. And I think we'll see, adding to this category, major areas, whether it's payers, pharma, and beyond, as disruption comes. We want to be the disruptor, not the disruptee. Now, sort of how I've ended up looking at these convergence spaces is I've been sharing the medicine track since Singularity University started. How many folks know about Singularity University here? A few? So for those who don't, real briefly, it's based in Silicon Valley. It's 6 years old. It was co-founded by Ray Kurzweil, who's now the director of engineering at Google, and Peter Diamandis, a physician who started the X Prize. And we look at how technologies are coming together on their exponential trends and converging, and ask how we can use those to impact the world, whether that's in poverty, education, global health, security. And in our 10-week summer programs, about half the team projects that have emerged have been focused in healthcare. We also have 2-day programs, 5-day programs. And what's been interesting is so many people come to Singularity University, they're interested in health and medicine, personally or otherwise, that I put together a program 4 years ago, first called Future Med, now called Exponential Medicine, where, unlike most medical conferences, we bring together folks from all across the spectrum, from Astro Teller at Google Health, to Dean Ornish, to Dean Kamen, to folks from the design world, IT world, investment, and ask, how do we reinvent medicine? We've grown the program from 100 folks now to the Hotel Del just down the street to about 500, and we'll be back there this November. So hope some of you can join us for a 4-day dive into reinventing medicine. A lot of new companies, startups, and relationships have started there. Okay, so let's look at a few areas really quickly. I apologize in advance to folks drawing the pictures. Health and prevention. So clearly, on the prevention side, we know that our behaviors are much more impactful than our genetics in terms of our downstream costs. So a lot of the focus is shifting to that area. You know, sitting is the new smoking is a bit of a new mantra. Sleep is incredibly important to our health. We're learning, you know, small amounts of weight loss can have huge implications, 30 minutes of exercise. And of course, now we're in this quantified self realm driven by consumers, which is moving more and more to the quantified health realm, where these can be used in sort of an FDA-approved manner. And of course, you know, if you've been to CES, there's 100 new step trackers that are coming out every year. Lots of opportunity there. But what I think is interesting is how they're going to disappear. They're shifting from the sort of sensors 1.0, the sort of accelerometers on our wrist, to much more interesting technologies, like the breathometer that can not only tell you your blood alcohol level, but how good is your breath level and how hydrated are you? Or ways that your computer camera can pick your emotions up off of your face just from the standard camera. Or even your voice can be a signal for Parkinson's or depression. This company called Beyond Verbal can, in this case, we'll see Putin here speaking. You don't need to speak Russian. If you turn the sound up, You might, as he's speaking Russian, keep it low. You can basically analyze his speech, and you could be doing this with patients over time, with yourself, to get insights, really interesting ways again to get other signals, breath, sweat, contact lenses for tears. In this case, you'll see a little bit about Putin's psychology as he moves through this lecture. We'll do the whole thing. But you can actually download an app from this company called Moody's and try it out right now on your smartphone. And if your wife is angry at you, it'll show up as angry, and it works. Trust me. Ginger I/O, you might have heard of, looking at psychiatric diseases like bipolar disorder. Your phone and the sensors in it can tell if you're manic or depressed. So lots of new realms coming into quantified self. Some are going to be surprising. The fact that your Wi-Fi now actually can pick up essentially your vital signs of multiple folks in a room, recently published by MIT. So we won't even need to wear sensors in some cases. And of course, the smart consumer devices are becoming more modular. We can integrate different things into them. They're going to become increasingly health platforms. They're embedding in our watches, obviously. Eric mentioned the ability to track your meds, very useful apps. Very early days. Remember, the smartphone, the iPhone and Android have only been out for 7 years, and it would have been hard to imagine some of the things that would have been built on those platforms. We'll see a lot of interesting things coming to our wrist. And of course, sensors are coming into our clothes, into our cars, the Internet of Things, the Internet of the body. It's going to really provide an interesting source of data. Even our diapers. This used to be the artifact from the future, my favorite part of Wired. And of course, last year, Huggies, for real, came out with TweetPea. You can figure out what that does. There's also data for number 2, if you are so predisposed to that. I'm trained in pediatrics as well, and we can now quantify our youngest patients. This is my son Leo a few months ago doing his part for Quantified Self, wearing a connected onesie. Of course, I don't need that data to tell me he's waking up every 2 hours, but if you're sending a kid home from the neonatal intensive care unit, you have new ways to track them, or even with connected teddy bears that are not as medicalized in the home. We heard about Google and the contact lens. What's interesting is that Google's partnering with Big Pharma, Novartis, to bring that to market in the next couple of years. Or the Philips eye pill that you can swallow and replace endoscopy. So as my friend Lucien Engelin says, we're going from wearables to insidables and beyond. MEMS devices, many others. Now the trick is, in this era of big data, how do we make sense of this? It's a bit overwhelming. So we need to have ways to integrate this information. I like to call it predictalytics. What do these trend lines mean before you go septic or crash your car? And it's only in the last year that companies like Apple and now Google and Samsung are building platforms where these technologies, whether it's a blood pressure cuff or your Google contact lens or your glucometer, can flow through your consumer devices and into your EMRs. It's still early days, but that data is becoming available. And so we're going to end up, back to the car analogy, where you can take all this information and, like our check engine light in our car, start to have a signal that's tuned to you. It's going to be different if you're driving a Porsche or an old beat-up VW, but if you could have an OnStar for the body that integrates this information and makes it proactive, we can have a lot of power there. So I think part of the layering we're going to see, layering of this information, is the analytics on top, and we're already seeing folks do that. My friends at Centrion, a company that started at Exponential Medicine, you'll hear from Jack Kreindler tomorrow, are doing exactly that. Sensors in the home, analyzing the data to give that check engine light to the clinical team before the patient with heart failure needs to be readmitted. And we'll have these in our personal sense. You've probably all played around with Google Now, so it's time to leave for the airport based on the traffic. What if it says, time to go to the gym now, you're behind on your steps, or a better way to manage your diabetes, or now it's reminding me to stand up for my stand goal. Early days, but these will get more and more tuned and more personalized. So it won't remind me to stand up while I'm on an airplane, for example, which it keeps doing. But it'll be smart and contextual. And again, coming to you in all sorts of different environments. And the scoring will change. It's not just going to be your step count or your hours of sleep. Imagine having a bit of a FICO score, like we have for finance, for your health, that can make sense and integrate this information in smart ways. And it can enable us to be coached, because we can tell people forever to exercise more and eat less. But it's often helpful if I prescribe you a wearable device or an exercise app that Dr. Kraft is watching, the Hawthorne effect. And now we're seeing the evolution of startups like Vita and Goki, where you have an actual physical person coaching you through the day. And that's even going to evolve to different types of coach. This is on Kickstarter. Take a look. Sound up.
Meet the world's first artificial intelligence personal robot. She's your welcome friend at any hour.
Good morning, Thomas. Time to get up.
Good morning.
It seems like you had a good night's sleep. 8 full hours and a good resting heart rate.
Thank you.
Your meeting with Jane is at 9:30. I put the coffee on.
She can interface with household devices. And she's also a personal stylist.
What do you think?
Why don't you try the blue tie with it?
Good idea.
You get the idea. That's coming soon, right? it won't even just be a virtual coach on a robot. It might be in your magic mirror. I saw this mirror in Dubai about a month ago. Here's a pretty bad video of it, but it's overlaying. It's using a Kinect, but it's overlaying in this case my physiologic data. And when I sort of learned to hack the system there the first time, I can switch to my neuro system. So you'll have a magic mirror in the morning you might look at that's going to give you insights into your vital signs, into your sleep, into your data, into your calendar for the day. So really interesting ways to blend augmented and virtual reality that are going to be changing the way we interact with this big data to make it insightful and useful information. And speaking of augmented reality, what if in the behavior change side, we can see future you when you look in the mirror? You know, future you and your P90X, future you. Or what if you keep having donuts for breakfast, future you, right? And you don't need to wait for the magic mirror. You can download apps today. Here's me now. Here's me 1,000 donuts later. Yikes, you know? I take a little pause. Or if I'm counseling a patient who smokes and I can show what her face is going to look like on 2 packs a day of smoking, that might change your behavior. So interesting ways to blend augmented and personal data to change potential behaviors. Or if you spend too much on Facebook, what happens, right? And speaking of augmented virtual reality, this is an area that's really exploding exponentially. You've heard about Oculus Rift. If you haven't tried it out, I encourage you to. Bought for $3 billion before they even went to market by Facebook. So Google said, we'll build one for $12. Here's the cardboard version. You can slot your smartphone in it. And think about how this is going to be used in healthcare to treat folks with PTSD and other realms. It's being used now in education for surgery to learn anatomy and put yourself in interesting environments. Microsoft coming out with HoloLens is going to be really interesting, not just for coaching somebody and doing plumbing, but in the operating room. And if I can do a little demo here, this is Oculus Rift. And if you put it on, you're actually seeing it 3D. This is actually a live case. You're in London, and you're in the operating room. You're looking around in real time. This could be used for education, all sorts of other ways that we're going to see augmented reality be played out. So watch that space. Let's turn off the sound there. Ooh, I'm going to have to, okay. Other realms of health and prevention that are going to improve our health is understanding our genomics. Clearly that's exploding in terms of exponentials. We're dropping the price of sequencing at twice the rate of Moore's law, to the point where it's about $1,000 today. And of course, with things like 23andMe, you can get a lot of information. The trick is that doesn't generally flow to our clinician. It's all about the workflow. If it doesn't flow into the workflow of the doc, they're not going to use it. You know, pharmacogenomics data is there on 23andMe. Here's 12 of my different drugs related to my genes. How does that become part of the workflow? That's critical. Or related to, let's say, athletic genes. I can actually download my 23andMe data, as I did, upload it to this new site called Athletogen, and look to see that actually I'm a pretty good sprinter. I'm fast, but I'm kind of lousy at cross country, so I can see my genes relate to that. And I'm terrible getting up early for exercise, but I have an excuse because my motivation genes are low. So you can tell all sorts of information there. But imagine having that kind of data as a clinician or a patient around other sorts of risk factors, simple ways of integrating that. And of course now there's an explosion of consumer-based companies that are enabling whether it's women to test their risk for breast and ovarian cancer in consumer-friendly ways. So it goes beyond the genomics, proteomics, metabolomics. The microbiome, of course, is getting really interesting. The ability to know that that impacts everything from obesity to inflammatory bowel disease. And you can try sequencing your own microbiome with companies like Ubiome and donating that data. We're learning that fecal transplants can cure things like C. difficile. And I think we'll see those sorts of therapies come into the market for all sorts of realms. It won't necessarily be a fecal transplant, but a probiotic that's truly tuned to you. How about optimizing our health? Of course, there's old technologies like yoga and meditation that can affect our brain in health in powerful ways. And now we're starting to layer in technologies there. We can not only read our brains now with EEG, et cetera, but we can apply energy to our brains. We can even read our brains with motor chips on the motor cortex, brain-computer interfaces to enable, for example, this woman who's quadriplegic to control a robotic limb. So we're enabling, in some cases, super enabling the disabled. And we're seeing these eventually go back and attach to the patient's own arm. So brain-computer interfaces, by the way, are here. That's the Back to the Future version. You can actually buy consumer versions that are just out in the market now, like the Muse. And these can be used, for example, to train kids who have ADHD to focus. And they play the game, they focus, they can come off the game, and they can maintain and get off of drugs like Ritalin. You can, again, try these technologies yourself, and this will be sort of like prescribed mindfulness or meditation. Instead of prescribing an anti-anxiety med to a patient, what if I prescribe an app and a headset? So lots of ways to integrate with our brains, and even we're learning from my friend Adam Gasly at UCSF that video gaming can be very powerful. Layering EEG, video games can improve outcomes, and whether it's cognitive disabilities or improving our normal ability, in this case, to multitask just by gaming.
Tom Campbell
And they're now combining that with movement, the Microsoft Connect era, and the combination of two can really even more quickly rewire our plasticity of our brains to improve cognition. So watch that space. We
in having
play
interviewed him, which
our
is what you guys are about to see.
And of course, it's not just reading our brain. We
so
can apply
many
energy in. There's a few
fascinating
consumer
topics
devices,
ranging
one
from
called
the nature
Think.
of
I tried out at
reality,
CES.
quantum
Apply some
physics,
buzzing
what are the
energies, like a
implications
coffee,
of quantum physics,
but
double
just
slit
from
experiment,
energetics.
data.
How about the future
reality
of
fundamentally
diagnosis?
comprised of
That's
data
becoming really interesting and can be maybe preventative and more proactive. Back to the neuroscience realm, we can start to map our brains, use that to understand everything from autism to Alzheimer's. And speaking of Alzheimer's, one of the big scourges of our day with the aging population, what if, as you can do now with a new scan, pick up the plaques 10 or 15 years before the patient develops symptoms at stage 0 as opposed to stage 3? That can even now be picked up by blood-based biomarkers or by a company called NeuroTrack with eye tracking. So potentially, if you can pick it up or predict it 10 years ahead of time, we can now take some of these new drugs under development, like the one from Biogen, and maybe give that to the patient before they develop symptoms. So again, being proactive in treating disease at stage 0. The diagnostic devices we have, like the stethoscopes, are becoming digitized. Of course, they now have apps for them. The apps then can do the diagnosis in some cases better than the clinician. So we can de-skill what used to take a cardiologist or an internist years of training can now be amplified. So the power of a nurse practitioner can be amplified, for example, or dropping off a tablet and a sensor in a remote village can give that access and diagnosis anywhere. So the digital doctor bag mentioned earlier is getting really interesting. The devices are shrinking and integrating. Some of them come with services like the new CellScope, and you can even get it delivered by Postmates if your kid has an ear infection. So lots of new tools at our disposal. And again, it's going to take us out of the traditional clinic. That's the old eye exam. The new eye exam from MIT's iNetra can fit in your smartphone. And their first market was in the US. They skipped that, went to India, where there's very few optometrists. And now they can also look at the back of the eye and do that in a mobile manner. Obviously, ophthalmology and the retina can be incredibly important for diagnostics and monitoring disease. And what's interesting is they now Uberified that. They launched this in New York last month. Blink, an eye technician can come to you just on the mobile app and do your eye exam, prescription, et cetera, all mobily. So disruptive to that realm. Cardiology, another big realm. We could monitor Buzz Aldrin and Armstrong landing on the moon. Now we have new tools to do that. You heard from Nercy earlier from Vital Connect, a great company building the patch. I'm actually wearing it right now. Streams my vital signs through the cloud. Anywhere in the world you work, you can log in and look at my vitals. And you can actually start to learn the trends. That's a lot of data. Who's reliable for it? Who's responsible? But now I can actually go and look at my trends. This is last night, actually. I woke up, I kind of maybe a little nightmare. I don't know. I woke up and I actually went back and looked at my heart rate's peaked there. You see it's 639 at like 100. So I can actually find that. I can actually track my stress levels as well. We'll start to mine this information, start to make more and more sense of it, not just for sleeping, but for chronic diseases. And the ability now, if I picked up a heart condition, to do further diagnosis is changing. This is a company called HeartFlow out of Stanford that can do virtual angiograms, a 30-second CT scan, sending that data to the cloud and reconstruct your coronary blood vessel, determine do you need a bypass or a stent. If you need a stent, what kind of stent? Maybe we'll 3D print the stent to match your own anatomy. Another company that I advise called Arteris can do a 4-minute cardiac MRI, send that data to the cloud, and completely do everything that Echo does, but more. And I think that will disrupt the Echo world. So the world of cardiology is going to shift with some of these diagnostics in really powerful ways, and all being enabled by this convergence of technology, imaging, cloud-based services, et cetera. Lessons from the let's say Intel world are enabling, I think, the disruption of dermatology. Is that a melanoma or a mole? All that's going to shift certain fields. So with all this big data now, how do we get smarter? We're not reading any more journals as physicians, so we need new tools. Actually, not even a new tool. Artificial intelligence is something that's moving quickly and is moving beyond what we might expect. And I don't think, as Vinod Khosla says, it's going to replace doctors. I think it's going to augment doctors, not AI, but IA, intelligence augmentation. And we're going to see AI play a role across healthcare. It's already doing so. And it's interesting that now IBM's partnering with Apple, Medtronic, J&J. It's going to become even more ubiquitous. And it's converging in our mobile devices. I was involved with the X Prize, $10 million prize to make a medical tricorder layered with sensors and AI. Over 400 teams entered the competition, where I think we're the last 10 finalists. One of them was started at our first future medicine program called Scanadu, and they've shipped 10,000 of these as part of a FDA-sanctioned trial. And what was really interesting is that they crowdfunded this on Indiegogo, and I think broke the record, like $1.6 million for a crowdsourced clinical trial. So look for this. That's going to really change the practice of medicine as these technologies come into our homes. And of course, it's beyond just the vital signs. The lab on a chip is here. Microfluidics is becoming the norm. Dipping your urine and amplifying the results, whether it's for urine or flu season. So the result can go directly to your doctor, to the CDC, to the NSA. Anyone can have your information. We're going to see new ways to scan for things like influenza, even printing out these tests at the point of care, as Harvard Wyss Institute did. Really interesting ways to blend that data. I'm an oncologist. I love the idea of doing blood biopsies as opposed to tissue biopsies. And we're going to start really tuning and personalizing oncology, but the ability to sequence every tumor, analyze it, crowdsource that information, and figure out the right cocktail for that patient. This is a company started at Singularity, who I won't have time to go into, but they basically were able to appify a test using a smartphone and take that data and put it anywhere in the world. Okay, what about the future of therapy, very briefly? You know, the drugs are being crowdsourced in terms of how they work. Thomas Getz's company, Iodine, enables you to say, how do you think that pill's working, whether it's penicillin or on patent drugs. Non-compliance is obviously an issue. There's new ways to make, smart connected pill boxes. I'm developing, you've seen probably Proteus with their patch and their raisin pill to track adherence and compliance. I've developed a smart PES machine for tracking your Vicodin, for example. We're seeing pills that can replace IV infusions that may release what used to be IV-infused drugs when you swallow them. Really new, interesting ways of delivering therapy. Some will be subcutaneous, like this remote-controlled contraceptive device. What happens when you lose it? Honey, where's the remote? What happens when someone hacks that device, or hacks your pacemaker, or your insulin pump, or steals your DNA from your glass and sequences? Lots of interesting implications. Sometimes the ethics and the policy lag the technology, including, as was mentioned earlier, who owns the data from our devices? What, again, if we could have ownership and share it as we see fit? Therapeutics is obviously shifting to this world of blended drugs, wrappers with apps, whether it's for diabetes or pregnancy. This is the first FDA-approved prescribable app for diabetes. It's now being reimbursed as well. They've shown that they can lower hemoglobin A1C by about 2 percentage points. So really interesting implications there. And companies like Omad and others are really leading the way of even prescribing behavior change with very effective platforms. And the ROI is there, whether it's heart failure or other complex indications, as Mayo published, appifying, someone's coming home with an app, a blood pressure cuff, and a social support group can really reduce readmissions. So telemedicine's been mentioned here. I'll kind of skip through that, just mentioning that. I've even used this recently. I had a little lump on my neck. It was probably benign. Doctor's the worst patient. So I downloaded the iDoc24 iDerm app, pressed the button, had a dermatologist take a look at it, said probably time to get it out. Pressed another button on ZocDoc, and 2 apps and 1 visit had it taken care of. So that's kind of that future of integrated therapy as we move forward. Okay, robotics was mentioned. I love the work from InTouch. Telepresence, really interesting part of therapy. Robotics beyond telepresence is getting interesting from the operating room. That's not new, but it's coming to robotic anesthesiologists. That's going to replace anesthesiologists. They're starting to deliver things in the new UCSF hospital, whether it's lab tests or food. We're seeing robotic pharmacists come together so they can do the not interesting part of pharmaceuticals and sorting pills. We're seeing robotics play a role in companionship. Very interesting robotics that are going to play a role in the home for aging in place. Here's one interesting one called Pepper that's going to be on market out of Japan in the next few months. Even other forms of companionship can come from these devices. And there's a dark side as well. We're not that far from some of the scarier applications of these as we move forward. Okay, I'm out of time, so I'm just going to mention a couple last things. Robotics can play a role in enabling the disabled, again, exoskeletons. And the portions of that device she's wearing are 3D printed. So really briefly, 3D printing is getting super interesting in healthcare. All sorts of ways to use it, from prosthetics to orthopedic devices. I can scan myself and print a brace that matches. It sure beats the old cast when you can have one that's something you can take into the shower. Orthopedic braces, scoliosis braces. The ability now to actually digitize these and apply these in the developing world, as 3D Systems is doing. The idea now that many parts of the world don't have access to these
it's like your World of Warcraft.
With this world of connected and digitized health, you can scan someone's existing leg and now literally create and print one that will work for them at almost no cost. So we're really starting to democratize healthcare. And again, this is a great example of convergence of lots of technologies coming together to solve really complex problems that have huge implications for individuals and society. So that's one piece of that. 3D printed orthopedic parts are coming. All sorts of things are getting interesting in this space. I was even at I can print myself. I have Mini-Me in my pocket. He's always fun to have around. You can do that with a Microsoft Connect. You might apply that to a patient who's missing part of their face. Or as this guy I met last week at MIT Media Lab, he self-diagnosed himself with a brain tumor. And I talked to him at the end. He's like, you want a copy of my brain tumor? He's like, here. So in my pocket, here it is. Stephen Keating, a really amazing guy. I encourage you to take a look at what he's doing. I'm out of time, so I'm not going to mention all the things about 3D printing organs and all the other realms there. We've sent 3D printers to space, one of our Singularity U companies. You could even think about printing medical devices in space where they're hard to get. And 3D printing itself is getting faster and faster. New technologies are making that 100 times faster. And with one of my new startups in telemedicine, we've developed a way to 3D print your own pills, your personalized poly pill with all your meds in it based on you that you can eventually print at home. So I will kind of skip to the end in the interest of staying on time, and with a kind of closing thought. I knew I should have not included 500 slides for a 30-minute talk. But the magic of having your laptop up here works. So be like Wayne Gretzky. Go to where the puck is going. Think about, again, the super convergence of all these exponential technologies and how they come together, how they're going to create our own GPSs for health, how we're going to start to crowdsource that information, just like with Google Maps when you drive and you get information back about the traffic. I think that same implication can come to healthcare. And just as we see these things connect the dots in different realms, I think we can really shift our sick care system to a healthcare system. Instead of being episodic and reactive, we can be much more continuous and proactive. And I think that's the real future of healthcare as we move forward, to take exponential convergence steps and realize that, like many of the technologies we've been developing, they're sort of already here, sometimes on our wrists. And it's the opportunity for all of us not to just predict the future, but go out there and create a bright and bold one. So with that, thanks very much.